This is Dr. James Womack at Golden Valley Memorial Hospital speaking about OPUM's remote knee evaluation tool and RPM monitoring platform. This is becoming increasingly integrated in both the care journey for non-operative conservative management as well as with the visibility for surgeons post-surgery. This can help catch at-risk patients earlier as well as have them evaluated sooner and catch them before this becomes a problem when intervention can be done earlier.
Hi, this is Dr. Jonathan Meyer, orthopedic sports medicine specialist from San Diego. Data accuracy and a promising reimbursement model make the OPUM technology extremely compelling as it helps eliminate unnecessary clinical consultations and improve outcomes for my high-risk patients.
OPUM is a great example of the high-value new digital technologies can bring to the orthopedic workplace. This can help improve workflow as well as efficiencies by improving accurate and objective data, which can then be relevant to the everyday practice. This can help standardize metrics and risk indicators across the care teams to improve visibility as well as streamline any complications. This can be the future of knee care.